My name is Liaw. Some people call me Dr. Liaw. I'm a child psychiatrist, and I'm in a new role at Children's Hospital Colorado as the mental health in chief. So usually children's hospitals across the country, you'll see a pediatrician in chief and a surgeon in chief. And because mental health has become such a huge concern for kids and parents and schools and primary care practices, they wanted to have somebody with mental health expertise and background helping guide strategy and our clinical operation and quality and family experience and prevention. And so that's my role.
You just answered my first 3 questions.
There you go. Done.
Okay. What does your day-to-day look like?
My day-to-day, I would say, and I say this every day, is I probably have the best job that I could have ever imagined, having as a child psychiatrist and as a physician. Yesterday, I met with the owners of the Broncos, our local, NFL football team, as they're really focused in improving youth mental health for all kids in Colorado and having Colorado set a standard for the country. I also oversee all of our clinical services, our relationships with the State Behavioral Health Administration and state agencies and the Gov's office. We help direct national, federal policy as well around youth mental health. But I also have this incredible team of Children's Hospital team members and staff, as well as CU School of Medicine faculty and clinicians, as well as trainees across all the disciplines that are part of the mental health care workforce. Get to meet with students and mentor them, get to think about how we think differently about the systems that support youth mental health across the state and across the country.
Can you set up just like the landscape of youth mental health in Colorado right now and maybe include some of the initiatives that you're seeing and the growing awareness around youth mental health in Colorado?
Yeah. Well, I'll start with some national statistics, which I think are good to ground us in as we talk about the Colorado landscape. So when I used to speak with PBS in the past, I was in New York City working, and it was, we would usually say 1 in 5 kids, this is pre-COVID, suffered or living with a significant mental health challenge, so much so that it was really impairing their ability to go to school, engage in learning, make friends, do the things they love to do outside of school. And nowadays, if you look at the CDC reports, it's 40% of high schoolers felt persistently sad or hopeless for over 2 weeks at a time. If you look at high school girls, it was 60% of high school girls who felt persistently sad or hopeless or depressed for over 2 weeks at a time, so that they couldn't engage in school and friendships and activities in their family lives as they would want to. 1 in 4 of those girls had thoughts of wanting to kill herself and wanting to die. And when you look at LGBTQ youth, it's 70% felt persistently sad or hopeless, and 1 in 4 had attempted suicide. In Colorado, and I say this over and over because we don't say it enough, and I hate repeating this statistic, but it's suicide. It's the #1 cause of death of kids in Colorado, beginning at the age of 10. We often see kids as young as 6 in the emergency rooms and our intensive care units who have made very lethal suicide attempts that sometimes we can help save a life and sometimes we can't. And it's heartbreaking to be able to say that, a 6-year-old, and know that that was the intent, right? And so that statistic begins earlier and earlier, certainly in more disadvantaged, like marginalized communities with less access to care. Certainly LGBTQ youth, BIPOC youth, Native youth have much higher rates of suicide and other mental health and substance use challenges that they're facing and navigating without support that they need. Nationally, suicide is the 2nd leading cause of death, beginning at age 10. And these rising rates began before COVID, before the pandemic, and have just been exacerbated by COVID, the isolation, loss of family members, substance use, and opiate epidemic that we're seeing, gun violence, you name it, it's impacting today's youth. Of that, too, we talk about a very significant treatment gap. So over 50% of kids who I just mentioned will never receive any support whatsoever. That might be through their school, that might be through primary care, that might be through mental health professionals. They will receive no support. And it's usually about a 10+ year lag time between the first time that you see somebody struggling when they're young to getting the support and care that they might need. That's a decade of life that goes by, right? And only 1 in 5 kids in the country actually gets the high quality evidence-based care that we would recommend, that we know that our research and decades of experience in mental health treatments and innovations know that they should receive. 1 in 5. Right, so it's just staggering, I think, the sort of enormity and the significance, and also just how complex and broken our systems are to support kids in their mental health.
Can you talk about the reasons why the 4 out of 5 young people do not get adequate access to mental health care?
Yeah, if you just in the state of Colorado, and it's incredible. Like if you think about, so there's 1.3 million kids in the state of Colorado. Children's Hospital Colorado actually considers the Rocky Mountain region, like a 7-state region, our population, right, of care. And so if you think about just within Colorado, right, like a lot of the kids who, if you want to get your kid on an outpatient, like a list to see a therapist or a counselor, it will be for specialty care, it could be 6 months wait time to see that therapist, or it could be 12 months or a year and a half, depending on if they have specialty needs like autism or intellectual disability or bipolar disorder or substance use disorder or medical complexity. Depending on how specialized the care, it's longer and longer waits. And then those providers are generally full, like their caseloads are full. In Colorado, 80% of mental health professionals don't accept insurance also. So if you think about, most people try to pay for their health care through their insurance, whether it's Medicaid or their employer insurance through their work. A lot of those don't cover the full range of services you'd want to see in mental health care, and so they have to pay out of pocket and go outside the system to do that. A lot of cases, you have to decide between rent, right, and your child's mental health care. And a lot of families are choosing their children's mental health care but can't then support stable housing, which is not a choice you should have to make in the United States, right? Think about rural communities, how little access we have even to primary care, sometimes even OBGYN, like attended births, then certainly into specialty mental health care as well. So a lot of the services are delivered through school. Schools are tapped, right? Schools are trying to educate kids, feed kids, make sure there's a safe community and environment. At the same time, they are also a de facto mental health system because we don't have one like that's really intentional and planful in the country. And it's so the disparity between what we would consider medical care, like if you needed to go to an emergency room, if you need to go to urgent care, if you had a broken bone, you need to see an orthopedist, if you had cancer and you need to go to a cancer center. Hopefully most kids in this country in Colorado have access to at least some level of support from those systems. Think about the mental health side. We don't have primary care for mental health. Emergency care is for adults. It's been built for adults, the crisis system. You don't have specialty access to care unless you, again, pay out of pocket or wait a really long time. And then certainly if you have complex care needs, like what would be like cancer care, right, for mental health, multiple specialists, different modalities, but doing it close to home, it's really tricky, right? Our whole system is not set up to succeed for kids.
There's this idea that mental health is sort of separate from your overall health care needs. Can you expand upon that idea a little bit more?
Yes, I actually started I thought I was going to be an oncologist when I was going through medical school. And I did a psychiatry, they call consult liaison rotation during medical school on the oncology service. And then I realized like how inextricably intertwined mental health, our relationships, and relational health were, right? All of it was health. And without one leg of this stool, it's really tough to have the other ones. And so I think the key is to place mental health within health and within well-being, is to think about mental health as a full society effort. Like every single one of us, whether you're a child psychiatrist or a parent or a teacher or a coach or an employer, business owner, right, whether you're in government, that we all are thinking about placing mental health at the center in every single policy, in every single decision, in long-term sort of investments. Like for employers, you think about it, it's your workforce. This generation that is suffering with the degree and severity of mental health challenges that they are and not getting the support they need, this is our future workforce, right? And how healthy our society is. And I think that's where we need to make fundamental shifts right now in how we invest, how we create systems of support, how we come together across society to really, I mean, we have a lot of catch up to do. And so, yeah, I would start with that.
What services or treatment options exist for young people who may not have the resources to easily access professional therapy?
Yeah, in Colorado, we do have a new program called I Matter, and that's something that came out through the Behavioral Health Administration and just got sustainable funding through the state legislature this last session. So I Matter is an online platform where any child, any family member can reach out to meet with a mental health professional and have free sessions and access, right? And they have care navigation as well that helps them navigate if they need ongoing services, and it's we say payer agnostic. It doesn't matter which insurance you have, the state will cover that. In general, the first line of seeking support and help is I hope every child has a primary care practice or physician or school-based clinic that they go to. And so I would generally recommend, if parents have concerns or if young people have concerns, to talk to your primary care doctor about that. Or alternatively, as I mentioned, the school districts and schools, a school counselor, or a school psychologist if there's one available in the school. There are crisis lines available throughout through the state. It's the 988 national crisis hotlines too. Those are always available, and certainly our emergency departments. We do see a lot of kids in crisis who will come to the emergency department as sort of a last resort. Sometimes it's the first touch that a child might have in the mental health care system or a healthcare system, but any avenue I think that families need to reach out for help, I think is the right avenue.
Is there any way to set the stage for viewers of this program as to the historical timeline of youth mental health? I mean, when I was younger, I don't remember ever hearing the term youth mental health. I'm sure it was a thing, and maybe I just didn't hear it, but certainly it seems like there's a growing awareness around the landscape of youth mental health. Can you sort of set the stage of like not the trajectory, but the timeline?
Yeah, I can give you both a personal and a professional timeline, probably over the last maybe 4 decades. How's that? And so, I mean, if you think about the level of stigma surrounding mental health, like we didn't talk about it. Right? Like you didn't talk about it at school. In high school, had friends die by suicide. We didn't talk about it. You had kids die by overdose. We didn't talk about it. A lot of families, they didn't talk about it. The schools certainly didn't talk about it. You definitely didn't talk about it with your doctor, right? It was something that was a source of shame, for families and for communities. It wasn't something that you sought help for because there were effective treatments and supports available. I think that things have changed dramatically, right? I mentioned I have 3 kids, one in each decade, so 12, 21, almost 32. And in parenting each of them, the conversation has changed for each one of them. This generation, was it alphas, right? The Gen Alpha, Gen Zers, they talk about it. They talk about everything. And sometimes for better or worse, because sometimes they're talking about it amongst their friends or looking on YouTube or on TikTok for mental health videos and things like that. So they're getting inundated with information and with conversation that's sometimes guided, sometimes not, sometimes supported by adults and trusted adults, and sometimes not. But they are, I would say, the one silver lining of COVID and the pandemic is we were all connected. Like that was the only way to connect was online and through your smartphone and with your communities. And so I think their comfort level with being able to talk about things, insisting on talking about things, talking about their struggles, I think with each other, with adults, I think is really courageous and needed in this conversation. I think the supports and the recognition on how prevalent it is, right? It's 1 in 5, 4 in 10, 8 in 10 in some communities and populations. So, it's the majority, right? That's different. And so thinking about how to really reduce stigma, how to have the conversations with trusted educational sources and materials and help when you need it, I think is so important. I do think technology has changed a lot. Like we had the Surgeon General here visiting after his youth mental health advisory came out, and then they released the social media advisory as well and technology advisory. You mentioned too, I did not even have email. I'm just going to date myself. We still had typewriters, right, and landlines with cords, right? Not everybody had their own devices. Not everybody had these sort of private digital spaces as well. And then the harms of some of these tools, like we're seeing now, right? A lot of kids are here in our care because somebody's been bullying them online and nobody knew about it, right? And some of those kids survived suicide attempts because of bullying. Some of those kids did not. All right, and it was all outside of the eyes of trusted adults, teachers, parents, coaches, folks that you usually turn to for help if you saw that happening. So they're growing up in a totally different landscape than we grew up in.
Are we giving enough weight to the effects of social media? Are we giving too much weight to the effects of social media? I've heard both ways.
Yeah, I think that's where we were in the state capitol, and there were a couple social media bills that came through and technology bills. And I remember our youth advisory council, or youth council on mental health members, they've created social media guidelines for youth by youth, right? They actually have a really smart middle path, right? I told you, like with what I advise parents in practice and what I do for my own kids is really limit the content, like making sure there's downtime so people have healthy sleep, making sure that I'm monitoring, what platforms they're on. But then the truth is, and the Surgeon General said this when he visited, it's like we put this plant in everyone's backyard in the United States, around the world, right? And we said, this is an amazing plant. Everyone should take this medicinally, and you should give it to your kids, even when they're little, like toddlers, right? And we'll just see what happens, right? And there's harmful effects, and there's incredibly powerful benefits. And I think we are in that state where we don't have enough science and guidelines and guidance to help make sure that it's healthy use, right? And not leading to problems with addictions or problems with exacerbating mental health conditions, impacting sleep and learning, relationships, things like that. So I think it's probably both, right? And it's probably a lot our young people, right, who are going to help us sort of find that middle path, right?
You mentioned young people being much more open to discussing their mental health challenges. We spent some time with a young man who's 18 who just graduated, and what struck me at the very beginning of being with him was we were in a classroom with all of his peers, and one of his friends was like, how did they find you? And he was like, my therapist. And it was just this moment of I love that. Just this openness that, like you mentioned, when I was younger, we would have definitely kept that, closed. Alejandro is his name, and he began court-mandated therapy around the age of 8 when his parents were going through a really difficult divorce, and he cites that divorce as a critical event that impacted his mental health, and in a very negative way. Can you speak to the impact of family dynamics, the importance of at least one stable relationship in a young person's life, and then how these sort of environmental factors may impact their overall mental health?
When we think about young people like Alejandro, right, who just tells you off the cuff, right? My therapist referred me for the program, or I got mandated to see a therapist when my family was falling apart, right? it's really powerful. Like we think usually in psychiatry, and I think about sort of the multiple factors at play when we think about the development of mental health challenges or illness. There are individual factors like your genetics and your early sort of environments early on in life that are really shaping sort of your brain development and those fundamental sort of brain architecture that's needed for every thought and every feeling and every behavior, right? Every action, every plan you make. This is the organ, right? Those things are developing even before birth and certainly through the first 3 years of life in this exponential fashion, and that is the platform for everything that comes in our lives, right? It regulates our entire who we are, right? Every organ system, our life path, and our relationships. And that family relationship is probably the most critical early environment we have in our lives. Parents, grandparents, foster parents, caregivers in our lives, coaches, I mentioned teachers, I mentioned whoever it is in your life, like that is a stable, caring adult who knows you, who can respond, can see if you're in distress or something's changed, who can help you get support or help support you when you're having a hard time. Those are critical. Like that, and that early sort of family environment, supporting families, even through, there's hard stuff that happens in life just because, all the time. And you mentioned in Alejandro's case, his family's going through a really difficult divorce, right? Those are your parents, right? That's your rock, your foundation. So who are the other adults in your life who can help support that family during that difficult time? It could be a therapist, mandated or self-sought, right? It could be a neighbor. It doesn't really, the science is showing too, it doesn't really matter who, right? As long as it's stable, consistent, responsive, attuned. And you don't have to be a mental health professional. You just have to learn how to notice, right, when something's off or something's different or the kid that you care about is struggling.
I want to talk about just the role that medication has in the treatment of these mental health disorders. Are you a proponent of medication? Are you wary of it? Are we over-medicating? Are we under-medicating?
Yeah, so on the topic of medication for mental health conditions, I'm a child psychiatrist because I wanted all of the tools in the toolbox to be able to address mental health conditions. Like you can, and also the reason I'm called the mental health in chief and not the psychiatrist in chief is that we have nurses and social workers and counselors and psychologists and family peer support specialists and psychiatrists and pediatricians who are part of our mental health team. One of the things that I've noticed in terms of medications, right, is that we always talk in child mental health about, start low, go slow, right? Make sure that you have the right diagnosis, the right assessment of what the trouble is, right? Always start with therapeutic interventions first, non-psychopharmacologic if you can, and there's not a safety concern. So family therapy, individual therapy like Alejandro's been a part of, right? It could be group therapies because peers really are powerful in the young people's age, right, throughout life, parenting supports. And then if medications could be helpful, like you mentioned Adderall for attention deficit, probably hyperactivity disorder, right? It's incredible, right? Like it can be a lifesaver for so many kids if it's truly an ADHD brain that they're experiencing, which means they're having difficulties with focus and attention, organization, having problems with social relationships because they can't hold impulses sometimes as they're growing up. They're doing things that are going to be dangerous to them. I've seen kids completely turn their lives around with medication. It has to be the right medication, and we always weigh the sort of risks and benefits of those. And at every stage of life, the brain is developing, the child's developing into teenager, into young adult, and then we reassess. Nowadays, I think what we see a lot of is people don't have access to the higher intensity therapies that we know are going to work for kids, and hopefully in lots of different settings for lots of different kinds of kids. So if you're missing a therapist who knows how to do a specialized treatment in this community, a lot of times people will throw a medication at it, and then another medication at it, and then another medication on it, and they all have their own side effects and interactions, and they're not necessarily treating the core issue. And so we will often in psychiatry deprescribe. take off medicines that we know could have long-term negative effects and keep the ones that we know are benefiting the child. And that's a really, nowadays too, we have a huge shortage of every mental health workforce. I was just giving a talk for the federal government on what do we need to do to catch up by 2030. We are so far behind sort of what the need is now and what the supply of our mental health workforce should look like. And you can't grow them overnight, right? Because you have to be able to understand how a family system, the school, how your brain chemistry, your genetics might be impacting, right? And what those causes could be.
What are we getting wrong when it comes to youth mental health?
I think one of the things as a child psychiatrist and in the field for a couple decades now is that we're doing a great job talking about the problem. I think what we need to pivot towards is doing a great job solving the problems and solving the problems for all kids, right? And not just in a research study, right, but not just in a hospital setting, even though we're sitting in a hospital, but we need to be able to bring the interventions and the supports that we know work for youth mental health to kids in their home communities, delivered by a very different, I hope, very diverse workforce, right? That it includes a lot of people from the community. And I think we've done a disservice creating two systems for healthcare, one for mental health, one for physical health, for lack of a better word, not having integrated systems that are for all of health, and not thinking about mental health care systems or healthcare systems as health, but rather thinking about what are all the other supports that are needed in schools, right, in community organizations, in sort of the daily life of families, in workplaces, right, that support mental health, and really investing in prevention. And I mentioned early in life, 1 million neural connections are happening and forming in the first year to 3 years of life, every second. So 1 million connections are firing in that infant's brain and body and creating that sort of basic architecture for everything that comes in the rest of their lives. We don't invest in the first 0 to 3 years of life. You look at maternal mortality, you look at infant mortality, you look at early childhood supports for families, whether it's food availability and healthy food access, whether it's housing stability, as we've talked about, and these sort of social determinants of health, whether it's community violence, domestic violence, exposure to trauma, climate and natural disasters. There is so much trauma happening that we're just kind of watching and not having a society-wide, systemic-wide approach to approaching the root causes where we could be intervening much earlier. So there's a lot we get right in the talking about the problem. There's a lot we could be doing getting to the root of these issues and creating healthy communities and supports for all families and all kids.
Is it possible that a rather simple solution that could help some of this despair in youth is simply connection and community?
Yeah, so Alejandro, our soccer ref and summer camp counselor ringleader, right, is emphasizing the potential role of connection and community. I'm 100%, 110, 100,000% supportive of really like doubling down on connection and community. It's not going to be a panacea. It will not be like a silver bullet, right? But is that if we were to build community and connection, meaning and purpose, like trusted, stable, caring adults for kids, like in the lives, their everyday lives, I think that would do a world of good. Like, and I think that we've talked a lot about like what happened around epidemic of loneliness and disconnection, fractured societies and communities. Like we're not raised in the tribe or the village anymore, right? Their individual families are struggling. Sometimes you have multiple families, like extended family coming together, communities coming together. That is the best situation for raising kids, right? Because you're not dependent on just one parent struggling to make ends meet and work and do all the parenting activities. But those sort of connections and communities, I think, are critical. And I think it's finding that wherever, like Alejandro's found it in soccer, it sounds like, soccer is amazing. Like sports, creative arts, service organizations, like giving back, right, to young people, somebody's going to be much more likely to listen to Alejandro's life advice than a doctor's life advice. And Alejandro's going to have so many kids on the soccer field that he sees in camps or in games that are going to come up to him and see him as a role model, right? And I think having people like that in your local community, having, whatever Alejandro's goals are to next, having that next set of adults supporting and supports, right, for him, I think are going to be critical. But at every stage of life, we need that, right? And so connection, community is key. And without it, I think we all suffer. And we saw that again during the pandemic. We all suffered.
And it's amazing to think about the ripple effect of all of it.
Yeah.
Going back to, you mentioned, just what's happening in the brain at such a young age, and you mentioned, 1 to 3 years old, and what it brought up for me is the fact that the prefrontal cortex is like not even connected to the rest of your brain until you're 25, and can you speak to? I want to talk about substance abuse among youth, and are there any points to be made around the legalization of marijuana and concerning trends among youth who are perhaps self-medicating with marijuana? Certainly it has shown to have incredible benefits for certain medical ailments, but then there's this flip side of that same coin of hyper access to something that could have a detrimental effect on your brain if your prefrontal cortex is not fully evolved.
Yeah. You talked about my favorite part of the brain, right? So the prefrontal cortex. And I used to teach an undergraduate course to a lot of theater people, actually. So we think about the brain structure. So everybody wear a helmet. It's right here under your skull. And then if you think about the way the brain has been developed, we have the brain stem, right, that attaches down to your spinal cord. A lot of your critical life functions are here: breathing, heart rate, day-night cycle. Inside, you have your limbic system, so the emotional centers, fear, instincts, so that we can fight, flight, or freeze, right? In the limbic system and emotionalities, and then the cortex, the outer parts of the brain. These are the most evolutionarily developed parts of our brain, and those are the last to develop. We develop our brains from the bottom up and from the back to the front. The prefrontal cortex is really interesting. It's why we have foreheads. If you look at other animals and primates, they don't have a forehead in the same way we do. And that's because you notice if the prefrontal cortex is here, it touches your critical brain stem functions, the midbrain. It touches the limbic system, your emotional brain, and it connects your cortex. Right, so these are movements, coordination. It's also, prefrontal cortex is like your master conductor of the brain. It helps you think before you act. It helps you plan. It helps you set goals. It helps you overcome challenges, to plan for those things. It helps you control impulses, right? It helps you navigate, like higher thinking, higher problem solving. It's critical, and it doesn't fully develop until age 24 and beyond, right? And so this is why car insurance is so expensive for anybody under the age of 25, 26, right? This is why when we make choices, adult choices in life, you want your whole brain, especially the prefrontal cortex, to be connected to the rest of the brain. Substance use, and we talked about, you're specifically asking about marijuana legalization, access to substances, right? I mean, I think when you think about young people, like as the teen brain is developing, their limbic system is ready to go. There's hormones surging because of puberty. This is all ready, locked and loaded. They look like adults, right? But their thinking is still in the teenage brain, right? So ready to go and no brakes sometimes, right, depending on the child. And so when we're thinking about things like, am I going to drive like 50 miles over the speed limit, I'm not going to have my seatbelt on, or not going to wear a helmet for things that are dangerous. Or am I going to try a whole host of different things at a party? What used to be alcohol and marijuana, hallucinogens, you name it, right? Am I going to try all these things because my teenage brain is exploring the world? That's what it's supposed to do. Toddlers explore the world, putting everything in their mouths. Teenagers do it by life experiences, right? The issue with substances, right, is that you don't know. Like nowadays, it's frightening as a parent too, that substances now are laced with fentanyl. They could die within one ingestion, right? Or they could use something that they're going to get heavily addicted to and not be able to break that cycle. The addictions pathways are also circuits. So when we expose ourselves to a whole host of substances, it could be a number of things, right? There's always a potential for substance use dependence and your body habituating that. For self-medication, as you mentioned, like you're struggling with anxiety, you're struggling with your mood, you're having horrible thoughts, about wanting to die. Like taking substances, right, it takes you away from that, right? Or helps you self-medicate in that moment. But then the after effects, right, are not long-lasting. And so I think when you talk about the legalization of marijuana, I think Colorado is one of the first states to do that. Now, lots of states have followed suit. It's just like with social media and technology. We don't fully have the evidence base to follow that longitudinal what's happened. Because the flip side of that is a lot of kids were getting put into juvenile detention centers and a lot of young people put into jail because of, being caught with carrying or using substances in public. And you don't want that either, because the justice system is also an adverse life experience, right? And so this is where we have to help educate young people. I would say as young as you possibly can on all of the ways to take care of your body and your brain and your relationships and your mind, right? And then we have to help kids who have gone a little too far, right? So that's impacting their learning, their relationships, their meaning and purpose, future choices in life. Help them get support when they need it, and then not put people in jail, right, for things, and track what all of our changes in policy, all of our changes in society are doing to mental health and other really important outcomes for young people.
Are there any new and possibly cutting-edge treatment options that you're aware of for kids with anxiety, depression, ADHD, or other similar mental health diagnoses?
Yeah, the question is about, are there any new cutting-edge treatments for kids with anxiety, depression, ADHD, the common mental health conditions that we see? Yes, there are actually, we have probably a lot of the tools that we need, right, to be able to help kids with all of those conditions. And, we're sitting at Children's Hospital Colorado in the eating disorders program that we have, right? That's a family-based treatment program, again, evidence-based. We are sitting one floor below our pediatric mood disorders program and suicide prevention program, and our anxiety program as well. We have a lot of the interventions that we need, right, to be able to help kids really sort of understand and face and manage. And for some kids, for example, I'll give you an example of panic disorder for anxiety, right? Panic attacks come out of the blue, can be incredibly debilitating. We have therapies that can cure panic disorder without medicine, actually. But it's a very specialized treatment that needs to be done with a professional that's, confident, competent, trained, right, to deliver it. And then the kid has to want to come to the sessions and has to want to recreate all the terrible panic symptoms that they have, And it takes a parent that's able to get them there, right? And broadband if you're doing it virtually, and all sorts of things, right? So we have a lot of the treatments that we need. Psychopharmacology as well has really advanced quite a lot in the last several decades, where you have a lot of medicines that are incredibly effective, that have very minimal side effects with the right sort of trusted healthcare professional guide. But I think, and then there's really cutting edge treatments, right? Like we have a precision medicine program here that looks at your entire genome and looks at your early exposures and looks at your, environmental factors as well, and can tailor precision medicine treatments that are basically for lifelong debilitating illnesses can cure, or can make those chronic illnesses that you manage day to day. it's amazing the pace of change for certain things, right? And like if you think about you're going to see a healthcare professional for the first time, there's no blood test for mental health conditions at this point. There's not one brain scan, right, that you can do to diagnose. That, I think, a mental health challenge. And so I think the root causes, again, of the sort of physical underpinnings of the illnesses and how they manifest through a lifespan, right? Those things we're still working on. But even like neuromodulation, all of those techniques we do a lot in adults, and we're working on sort of the safety and quality and effectiveness profile in kids now. But the pace of change sometimes is not fast enough for the number of kids that need that intervention.
Are there any alternative treatments that may not be part of the mainstream that you would like to talk about?
Any alternative treatments that are not part of the mainstream? I mean, actually, when I went into medicine, I was an anthropologist, so I was a medical anthropologist in training, and we're studying different systems of healing, like across cultures. And there was a movement towards more holistic approaches to health and to mental health, right? So there are the usual foundational core building blocks of mental health, wellness in general, which are healthy, like lifestyle habits. So healthy diet, balanced diets, omega-3s, right, for brain development. Also exercise and movement, time outdoors, time with friends and family and in community, pursuit of things that bring you enjoyment and pleasure and relaxation and stress management, right, and things that also bring you a sense of purpose and mastery in the world and meaning. Right? There are like the fundamental building blocks, I think, that would be good for everybody, right? And for all conditions. And I think that there are a lot of other treatments out there, and I think because I'm a physician, like it's always weighing what's the evidence, what are the risks and benefits? How can I help advise families and young people in their choices? And so we're always open to those things. Are those the type of things you're thinking of?
Perfect. What excites you most about your job and the impact that your team can have on youth mental health?
What excites me most about my job and the impact that our team and many teams right, across the state can have on mental health is I think this is our moment, right? This is the time. Like, when I was thinking about moving from New York City to Colorado, I was talking to the CEO of our children's hospital, Jenna Hausman. They had declared a state of emergency for youth mental health just a couple months before I came out to Colorado to interview for this position. Like, this is the moment for, I think, as I mentioned, the whole society, like all of Colorado, to come together and say, what do we need to do to help support young people's mental health and healthy development? How can we support their physical health and well-being, their learning and education, their home communities and safety and flourishing and resource opportunities? How can we support their mental health as central to all of that? And I think that in this job, I feel like a conductor, right? Like, there are many parts of the orchestra across the state, and our job is to figure out also actually when to conduct and when to play, and what we can create together that's going to be just so much more impactful and powerful, and I would hope a model for other states. How do we borrow shamelessly from the things that are working in other communities and other states, other sectors, other parts of healthcare, or other parts of education or business? How can we use technology to fuel innovation? How can we find public and private partnerships? How can we use government at every level, right, and move those levers so that we're aligned to building a system of supports for kids throughout their lives and their families for generations to come? I think that's my day job. It's pretty awesome, right? So
that is awesome. So I heard you say in a talk that you gave about the parent's job is to listen first rather than to jump in with advice. What advice do you give to parents and adult family members regarding mental health of the children that they care for?
Yeah, so my advice to parents when it comes to their kids' mental health, well, one, put your own oxygen mask on first. That's always key, right? Because if you're not feeling supported and centered, and that your mental health is in a good place, right? Or your health is in a good place, or your family's in a good place, it's going to be really tough to support your child, right? So always sort of think about, and I think self-care gets used a lot. I think during parenting, it's like it's one of the most important things you can do, because you're modeling that. You're your child's first teacher. They're watching every single thing that you're doing. And also, I think, be attuned to your kid. Like, every kid's unique, right? And you'll see that through their development, as little ones, all the way through when they're adults themselves. If something's not right, something seems off, don't be afraid. I think that's, so many people are afraid to ask, is everything okay? How are you doing? And don't jump in. Like, take a few beats, right? It's hard to sit sometimes with silence, or with a teenager who doesn't want to talk to you, or a kid who's like, talk to the hand, right? Or got their screen in their face. Like, give them time, right, to come, but check in. And if you're ever worried, reach out for help. I think that's the thing. You're never alone in doing that. But I think that's the main thing. Know your kid, take care of yourself, reach out for help.
Why do you care so much?
It's a good question. Why do I care so much? I was reading, so I actually want to go into film before medicine. And so I was reading just a clip from an interview with a director, and he's like, you have to, like, so much passion when you're in your 20s trying to make a film, right? And you have to care more about that than anything, right? And for me, the thing that I care the most about is kids. It's always been kids, and I don't know, maybe a past life, like I don't know what, but it's always been a focus on kids, and it's always been a focus on making the world right for kids. And for me, mental health was that's my backpack, that's my toolkit, that's my experience, and I think it's impacting so many kids right now, and I have opportunity to help make it right with a lot of people who can help make it right. So.
Okay, I have time for a couple more. Okay. What is utopian future? Whether it be 5 years down the road, 10 years down the road, 20, 50 years down the road. When it comes to youth mental health, what is the utopian future?
What is the utopian future for youth mental health? I honestly would say that every child has the right support that they need at every stage of life. And I would say that begins even before they're born, that their parents have the right support that they need to bring a child into the world and to raise that child, in a healthy, safe, supported way, that we invest really early in those first 0 to 3, 0 to 5 years of life that are so often neglected in all the ways, that we empower families and support families in their journey, raising amazing people, and that we have one system of care for health and mental health. We don't have a different system for eyes and different system for teeth, different system for mental health that we do for the rest of healthcare, and that everyone has access, at least a basic level of access to that early on, so that people don't end up in crisis and suffering unnecessarily.
You said you were an anthropologist,
Mm-hmm.
so I'm curious where the United States stands on a global scale. I know, like, Japan has issues with kids isolating, and other
Mm-hmm.
regions are also having issues like this, but are we worse off or on par?
Yeah, great question. So where does the United States stand? And I'd have to brush up on some of my global mental health landscape, but we spend more money in healthcare and mental health care, in the juvenile justice system, in the child welfare system, in the pharma industry than any other country, hands down. And we have no outcomes to show for that amount of money being spent in a broken system, and not in concerted, coordinated, thoughtful investments in young people and their families, right? So if you look at, so we mentioned Japan and other places, each unique society and each unique culture has its own Achilles, right? Like you see, like the high pressure academic, Asian educational systems, right? And then kids gaming and online and isolated and not connected to other kids, right? In the usual way you see kids connecting with each other and playing, right? So you see unique challenges there. You see that in our society as well. You see other societies who have invested in kids and in families. This is family leave when kids are born. Can you imagine, right? Actually being like one of the, for example, Scandinavian countries where you've got paid leave for families. Both parents, right? That you have a basic income, you have access to health care for you and for your child. You don't have to worry about making sure that you stay employed so that you have health care for your family. You don't have to change insurance every time you change a job, right? You have access to early intervention supports if your child is having developmental issues that are funded by the state, right, or the country, healthcare system. You have access to high quality education that's not based on who's got higher property taxes. Like the level of disparity here for the poor outcomes we have in the global standing, right? This is not where we should be. It's not because we're not throwing enough money at it. We're not investing in a thoughtful system in all the ways that we support kids and families in this country.
Just expanding upon that a little bit, the disproportionate effect on BIPOC and LGBTQIA youth.
Yeah.
Can you just expand upon that a little bit, on like their access?
Absolutely. So we were talking about mental health disparities, particularly for LGBTQ, IA positive youth, and BIPOC youth. It is pretty stark. I mentioned 80% of the mental health care workforce in Colorado is self-pay, private pay, right? So if you can't make that fee on a regular basis, you don't have access to that 80% of the mental health services in the state. If you are growing up in a place where you can't talk to your family about who you are, your identity, if there's significant conflict in your school community as well, and you can't reach out to your school counselor or teacher, right? You're going to have so many other barriers to accessing the support that you need. And if you think about like our BIPOC youth too, like the highest rates of suicide are in young Black children. So in that sort of 5 to 9, 10 to 14, the most dramatic rates of increase we're seeing in Black youth, particularly Black male youth. Attempts in Latino youth, right, and Asian American youth as well, really suffering from a range of mental health conditions, and then Native American youth, Alaskan Natives too, just dramatic differences in both prevalence rate and complexity of mental health and substance use conditions, but also so much less access to the care they need and deserve.
I know we're out of time, so is there anything that you would like to add? I wish I could spend a whole nother hour with you, but...
Yeah, honestly, thank you. Thank you for creating such a thoughtful series and a conversation, and we can have more time too. So,
all right.
Yeah.
Thank you so much.
Thank you.
Lovely and incredibly helpful. Really helps paint the picture that we need to see.